If you have neck pain and that is irritating you day to day and disturbing you for the day to day life during your job, you may think that surgery is the only one solution. As a radiologist, doing almost 200 scans per day of all these patients having neck pain, and for the last 25 years, I would like to say surgery is not the solution for almost 95 to 99% of patients. Let me explain to you why. First of all, let me show you that MRI of the cervical spine. The MRI of the cervical spine will show you most of the important structures. For example, it will show the spinal cord, which is a continuation of the brain and which comes down along the back, and the nerves will go from these spinal cord to various parts of the body. So these cervical cord lesions, even if they are there, it is not the reason for doing any surgery. Number two, the structures are seen are the bones. These bones are seen here, and as I show you here, these are numbered like 1, 2, 3, 4, 5. Like that, these bones are numbered, and any problem in this bone, like infection or something like that, usually treated by medicines and not by surgery. The third important part of this neck is the joints and the muscles. The muscles form the major bulk of the neck, and also there are numerous joints. So these joints keep on moving every day and they are prone for wear and tear. As the age progresses, let's say above the age of 45, you may have some condition called a wear and tear condition called cervical spondylitis. Cervical spondylitis is a feature where the bones and joints will go for wear and tear, and the space between these bones will start decreasing. And the most important cause for the pain are the narrow roots. There are narrow roots which come out from the each and every joint, and they go to various parts of the upper limb. They supply the various parts of the upper limb. The most important thing is if there is a obstruction or there is a narrowing of the foramina, there are small holes called foramina. From the foramina, various nerves will be coming out and they supply various parts of the body. For example, the nerves coming from C1, C2, C3, C4 will supply the neck, and the nerve coming out of C5 will supply the shoulder, and the nerve coming out of C6 the elbow, C7 the wrist joint, and the C8 will go to the fingers. So even though there is a compression on the nerve and there is a pain along your upper limb, you may think that is a cause for the pain and it has to be removed so that your pain will subside. But let me tell you few things here. If there is a pain, the most important treatment for all this particular pain is some sort of pain reliever, pain relieving mechanisms. Let us say, for example, you can go for some sort of physiotherapy or some external applications and see that the pain is relieved. Why do I say that? Because the most important problem in cervical spondylitis is the pain. It is nothing but the pain. If the pain is relieved, you should be all right, because the pain and the nerve compression is not like cancer or tuberculosis which will progress and it will destroy your bones, nerves. Such things will never happen. Occasionally you may have some numbness and some problem with the nerve distribution. Let me tell you, these are called as the cervical vertebrae. These are number 1, 2, 3, 4, 5, and nerve roots come out of the foramina. And when I do an MRI, I may see changes of cervical spondylosis. I also see small bone projections which are pressing on the nerve roots causing the pain. And you may think these small projections have to be removed to relieve the pain. I tell you most important thing here. Even though you see these small projections, let us say if you got a small projection at C5, the pain should be in the shoulder. If there is a pain on the wrist or if a pain on the neck, that particular projection is not the cause for the pain. Hence, you need not do surgery for that particular projection. So, what I am telling is, even though there is a particular compression, the particular root should be compressed, and the particular nerve root which are supplying different part of the body should have the pain. If there is no pain, then surgery is again not required. The most important point here I would like to say why the surgery is not required, because the body has got lot of healing mechanisms. The body tries to heal everything. The body has got a defense mechanism. The body cells keep on multiplying, dividing, healing. So when there is a nerve compression, there will be there will be a lot of swelling. So that swelling causes a lot of pain in the human body. So over a period of time, this swelling will reduce and the pain will come down. So most important thing is take care of this particular pain causing symptoms, and within 4 to 6 weeks this pain will reduce. If the pain is not reducing over a period of 4 to 6 weeks, then we may have to give what is called the guided injection. Under guidance, you may put a small needle on the particular space where the nerve is coming out and the pain will be reduced. Friends, surgery or doing a interventional procedure may not be necessary for all patients with the cervical spondylitis or neck pain. The body has got remarkable power, remarkable healing capacity to solve all these problems. If the pain persists, then you may have to let the pain persist for more than 6 to 8 weeks, then you may have to think of a surgery. Finally, it is the injury which causes the pain. The most important injury which causes pain is the stress, anxiety, and apprehension, and the various other mechanisms which is happening in the body. The injury to the body is not just physical, chemical, but also mental. So this mental pain will cause you a lot of pain. So what you need to do is work with the love, affection, and see that you will not have pain forever. So friends, relieve anxiety, relieve stress, work with the love and affection, and help everybody and respect everybody. I think your pain should subside within 4 to 6 weeks. Thank you very much.